Good evening. My name is Faith Abiona. I'm from William Peterson University. Today I'll be doing an assessment of your head, ear, nose, and throat. Okay? Can you please tell me your name?
Precious.
Precious what?
Abiona.
Oh wow, Precious. Thank you for coming in today. Okay? Before I move into the assessment proper, I would like to ask some questions. Okay? Does Precious have any childhood disease I need to be aware of?
No.
Any measles, chicken pox, rashes, whatsoever?
No.
Has she ever been admitted into the hospital?
No.
Has she ever had any surgery whatsoever?
No.
Okay. Precious, do you react to anything like drug, food, the weather? Do you have any allergy? No, poor Precious doesn't have any allergy. That's good. Are you up to date on your immunization? Is Precious up to
Sure,
date?
sure.
Okay. Did she have the annual flu shots?
Yes.
Okay. Can you remember when she had the annual flu shots?
The last one is in January.
January this year. That's awesome. Oh, I'm glad. Is she currently on any medication I need to be aware of?
No.
No, you are not on any medication. That sounds so good. Is there any family disease like hypertension, diabetes, any issue with kidneys in your family? No. Wow. Before I go into the assessment proper, I would like to read the Precious vitals. It has been done earlier. For today's visit, Precious temperature is 97.6. Our respiration is 20. Our heart rate is 86. Blood pressure is 108/76. She's saturating as 99 on room EM. Our height is 46. Our weight is 46 lb and our height is 119 centimeter. So Precious weight and height runs between the normal percentile. She's at 85 percentile on the growth chart. Precious, I'm moving on to the assessment proper, okay? I am going to be gentle. It's not going to be hurtful in any way. If you have any question, you let me know, okay? I'm starting from your head. I'm going to check your head, your nose, your eyes, your ear, and your throat, okay? I'm starting with Precious head. Precious head is symmetrical. There is no bruising. Do you have headache at the moment? No headache. I'm going to have a little tour. I'm palpating Precious head. Precious head is symmetrical. There is no hair loss, no bump, no swelling, no edema, no depression of any. Precious head looks beautiful. There is no tinea capitis, no lice. Seen so far. Your head looks so good. Okay. I move on to the temporal artery. So this is palpable, and I go to the temporal mandibular joint. Can you say Oh, that's good. So the patient does not have any pain on the temporal mandibular joints, and that sounds good. I move on to look at your ears, okay, and to assess your ear. Precious, do you have any pain with your ear? Any pain? Okay, this is ear tugging test. Precious does not have any pain. Okay. I'm going to say some few words to your ear, so you tell me what you heard. Okay. Can you cover your left eye? What did I say?
I'm going home.
Going home. Good. Can you close your right ear?
I love my mom.
You love your mom. So Precious has no any hearing loss. She's able to hear the whisper. I whisper to her ear. I'm going to use my instrument to have a quick check on your ear. Okay. I'm start using the otoscope I have with me here. So I'm going to start. Sorry. So I'm going to start with your left ear, Precious. It's not going to be hurtful. I'm going to be gentle as much as possible. So I'm going to pull Precious ear. Then I'll hold this just like a pen. Then I'll hold this. Wow. So Precious ear canal is patent. No edema, no redness. There is no purulent discharge. the tympanic membrane is opaque, no edema, no redness. Thank you, precious. Let's try to do this. Let's try to tie. You know what the problem is. Oh my God. So I go to your right here, precious. I'm going to pull on your hair a little bit. Try to maneuver the otoscope. So precious, right here looks patent. The ear canal is patent. The tympanic membrane is opaque. There is no discharge, no purulent discharge, and there is no redness. Precious, thank you for letting me assess your hair. So everything about your hair looks okay, right? Good. Okay, I'll move on to your eyes. Precious, I'll start with inspection of the eyes. Precious sclera is white. The conjunctiva is pink, no discharge. Then I'm going to assess precious peripheral view. So precious, I'm going to take my hand as far as much as possible. Then I'll bring it closer to your eyes. So when you start seeing my finger, you let me know. Okay. You can see. Good. I'm going to assess the assist cardinal of gaze. So I would like you to follow my fingers as I move it around your eyes, okay? I'm starting with your left eye. So precious extraocular muscle is intact. She's able to follow my hands, move around eyes. To move further in the examination, I'm going to use the ophthalmoscope to have a better view of precious eye. So starting with the left eye, I'm going to assess our left eye with my left eye with my left eyes too. I'm going to do the assessment through my left eye. So I'm going to assess for red reflex. Precious has red reflex. The optic nerve is intact, no detachments. The fundus is perfect, and the pupils reacts to lights. So moving to the right eye, precious, I'm going to assess your right eye, okay? So using my right eye to assess your right eye. So precious has red reflex. The pupils constrict, that is, in other way around, reacts to light, and the fundus is okay. No macular degeneration, no retinal detachments, and the optic nerve is intact. Thank you, precious. So your eyes look perfect, okay? And just before conclusion, I want you to do visual acuity. I will assess precious ability to read. Precious, I would like you to close your left eye, okay? And you tell me, you try to read these letters for me. What letter is this with your right eye, precious?
E, T, H, F, S, O, J, H.
Good. Can you close the right eye and try to read this for me too?
E, T, H, F, S, O, J, H.
Perfect. So precious is able to read at 20 what a child of her age should be able to read. So far with her eyes, there is no abnormality detected. Precious, I'll move on to your nose, okay? So I will assess your temporal, the frontal sinus. Do you have pain? Do you have pain in your maxillas?
No.
No, so there is no tenderness, no pain. So using my pen light, precious, I want you to tilt your head backward. I would like to assess your nostrils. So precious nostril, patent. It looks pink. For better view, let me use my orange. Precious, I want to have a better view of your nose, okay? Wow, so Precious right nose is patent. There is no deviation. The turbinate bone is intact. Can I look at it right? Left nose, please. Wow, it's moist, pinkish, no drainage, and you have intact ciliary. Here, thank you, Precious. And there is no drainage. So we move on to the mouth, okay? From inspection, Precious lips is moist. It is not dry. Can you open your mouth for me, Precious? Let me use my pen lights to have a better look. Can you open your mouth? Wow, say ha, ha. Wow, this is Precious' mouth. The palate is pink. The tonsil is intact, no redness, no exudates. She has normal dentition for her age. And I would like to use the tongue depressors to assess the back of your mouth, okay? Precious, a second, please. Stick out your tongue. Put your head down. Then I want to press your tongue down. Open your mouth wide. Yeah. So the uvula is in the midline, and the tonsil is at the normal position, no drainage, and she has normal gag reflex. Precious, can you stick out your tongue? Precious, stick out your tongue. Can you move it around? Wow. Precious has normal tongue movement, accessing cranial nerve 12. Good. So Precious, we are moving on to the last aspect of the assessment, and that is going to be your face, okay? Precious, I'm going to assess your lymph node. I start with the preauricular lymph node. Do you have pain? So I go to the postauricular lymph node. Any pain? So there is no lumps, no tenderness. I go to the occipital lymph node. There is no lump, no tenderness. Then I come to the tonsil lymph node. So there is no tenderness. I go to the submandibular lymph nodes. Nothing detected. And I go to the submental lymph nodes. So nothing normal detected. And I come to your clavicle, okay? I go to the posterior clavicular lymph node. Papates, no enlargement, no lymphadenopathy. Good, Precious. Precious, can you look at my face? Can you raise your head up? Can you? Good. Can you turn your neck down? Can you look sideways? Look towards your eyes. So Precious' neck is intact. She has a range of motion, no torticollis. Precious, I want to assess the carotid artery for any bruise. I use a bell on my stethoscope too. So Precious has normal blood flow in the carotid artery, no bruise. And I will assess the thyroid gland too. Hold on, Precious. Assess your thyroid gland. Oh, and I said the trachea. The trachea is midline, no deviation. Then I look in, palpate the thyroid, no enlargement. Let me see if there is any turbulence blood flow in your lymph, in your thyroid. No turbulence detected in your thyroid gland. Precious, for the final aspect, I want to have a better inspection of your thyroid gland. I would want you to take this water, put it in your mouth, then I tell you to swallow, you swallow, okay? So this is going to help me to assess your thyroid gland better. So Precious, try to swallow the water. Good. So there is no enlargement with swallowing. So the last part, I will try to assess your facial nerves. Precious, I'm going to try to touch all this into your face. you let me know if you feel sharpness or dull, okay?
Sharp. Dull.
Talk louder.
Dull.
This one is what?
Sharp.
Sure. Good. So Precious has normal sensation in her face. Precious, can you try to smile for me? Good. So Precious has normal facial symmetry. No drooping. Nothing suggesting but bell palsy. Precious, to round our assessments, I hope so far I want to give you some education for your age, okay, Daddy? Precious, I want you to continue to maintain a sleeping pattern of at least 8 to 10 hours. Is Precious sleeping very well at night?
Yes.
So she needs to ensure consistent routine bedtime. Precious needs to go to bed on time, so at least to prepare her ahead for the next day. Did you get my point?
Yes.
And she be eating good diets?
Yes.
So Precious, you need to continue to eat good diets like vegetable, fruits, chicken. You need to eat good diet to promote your immunity, okay? And next, does Precious like watching TV?
Yes.
Precious, okay. So for her age range, she's to watch TV for no more than 2 hours, okay, per day. Anything above that is dangerous to her size. And I will remind you of annual flu shots every year. Precious should ensure that she takes her annual flu shot. And it is also wise for you to engage in exercise. How long did she exercise in a day? How long do you exercise in a day, Precious?
1 hour.
So you have to engage, in moderate exercise, moderate to vigorous exercise for at least 1 hour in a day. And you try to read your book, do your homework, and be obedient to your teacher as well as your parents. Do you have any question for today, Precious?
No, we don't have
So
any
far, our physical examination for Precious head, our nose, ear, eye, her mouth, and neck today looks perfect. There is no abnormality detected so far. Precious, thank you so much for coming in today.
Thank
God
you
bless
very
you.
much.
Yeah,
Thank
bye.
you. Yeah.